Welcome back to KVUE News Midday. 11:24 is your time. And drug overdoses killed more people in Travis County last year than homicides and vehicle collisions combined. It is the leading cause of accidental deaths, according to the Travis County Medical Examiner's Office. Now, that's why the Austin City Council and Travis County Commissioners declared drug overdoses as a public health crisis. Dr. Kelly Green is an associate professor of psychology at St. Edward's University. She's also the founder and director of the new certificate in evidence-based addiction counseling. And Dr. Green, thank you so much for joining us here on KVUE Midday.
Absolutely. Thank you for your interest in this topic.
Sure. And you are about to launch a new series of on-demand courses called Raising Resilient and Addiction-Resistant Kids. So what is addiction resistance, first of all?
That's a great question. And addiction resistance is trying to prevent addiction while you acknowledge the likelihood that your kids may use alcohol or drugs. And so it focuses on acknowledging that, minimizing risk factors, building protective factors, and having really open lines of communication where you can give your kids accurate information and kind of bestow the values and ideas that you want them to know about substance use and what their particular risk factors are for addiction.
And that leads me into my second question, which is kind of three parts. So what are risk factors, protective factors, and what can parents do?
Absolutely. So it's such a complicated equation. And some of the risk factors are things we can't change, like our genetics. 50% of our risk for addiction is our genetic vulnerability. We know that people are at higher risk if they also have mental health problems. So people between 12 and 17 who've had a depressive episode are actually twice as likely to be using alcohol or drugs than those who don't. So the risk factors are a lot of the ideas that they have about alcohol and drug use, but also the lack of knowledge about what the risks are for them. The protective factors are things that sometimes we can make more of a difference in. So these are actual education about what alcohol and drugs do in your brain. These are skills like coping skills and resilience and having strong bonds and engagement in the community. And one of the things that I try to work with parents on is to focus at least as much on the protective factors as they do on the risk factors. I think a lot of times parents get caught up in the, trying to scare their kids out of using instead of giving them the education they need to really make informed choices and know what to look for if they are going to be experimenting. What are the signs that their experimentation is becoming more problematic?
And I'm so sorry to interrupt. How young can you start this addiction resistant training? Is there an age that's too young?
I don't think so. I actually start with my kids when they're infants because there's things that you can do like help them learn to self-soothe and help them know that whatever they're feeling is okay. One of the biggest tips I give parents of kids at all ages is to try to help fight that idea that, good vibes only, that don't worry, be happy mentality.
Dr. Kelly, are you still there? And I think we lost Dr. Kelly, but we appreciate her time. We're so sorry about those technical difficulties.
Protective later in life.
Well, there you are. We lost you for a second, Dr. Green. But I wanted to thank you for your time. We were wrapping up anyway. Yes, you're still here. Thank you so much for joining us here on KVUE News Midday. Technology, right? Sometimes it works and sometimes it just goes out on you. Thanks so much.
Roll with it.
Yeah, thank you.
Thank you,
Dr. Green.